Midlands today, and he was just a baby. He doesn't look much of a baby there, but he was when his mother was killed, and he was shot by gunmen who were hunting for bushmeat in Cameroon.
With shotgun pellets left in his arm, Shufai's pain continued until now.
Yes, 8 years on, and Shufai is pretty well fighting fit, thanks to the work of 3 vets from the East Midlands. Angelina Sochi reports.
This is Shufai. He lives in a sanctuary at a national park in Cameroon, where he's been ever since he was rescued as a baby. In the first few months of his life, he suffered severe injuries to his arm. He'd been clinging onto his mother when hunters opened fire. And over the years, his movements have become more limited. That is, until the charity Ape Action Africa got involved and brought in specialists from the East Midlands.
It came out in November last year because they said they had a gorilla and a few other things for me to look at. So we took x-rays then, and then I went back to the UK and spent the next few months trying to get a team of good surgeons to come and work in the forest.
Despite planning what they would do, there was still uncertainty until Shufai was on the operating table.
We'd sat down and we'd planned it back in England, and we had a variety of plans that we might use. And we decided that we'd go with the simplest option.
A piece of bone was eventually removed to relieve his pain and stop the problem getting worse. Now all that Shufai has to worry about is getting himself better and getting lots of attention from his keeper. Angelina Sochi, East Midlands Today.
Well, joining us in the studio now is Sharon Redrobe from Twycross Zoo, who I think you saw in that report, and Sandra Kaur from the Pride Veterinary Centre in Derby and also the University of Nottingham. Thanks for coming in. Sharon, if I can start with you. Have you ever been asked to do something like this ever before?
Well, I have actually, similarly. It's been my career for the last 20 years to work with these sorts of animals, both in the UK. I'm privileged to be going to Africa at least once a year.
So you're a veteran of this kind of procedure, aren't you?
Yeah, I love it. I love being able to help out there as well as over here.
What's the difference then? Because I mean, he looks so human. I mean, gorillas always do. To doing maybe that operation, to doing it on a human. Well, you're the expert surgeon there. Go on.
Probably not a lot. I'm much more used to dealing with cats and dogs, so actually we spent quite a lot of time talking to human surgeons who gave us a variety of options as to how they would treat that similar sort of a problem, I guess, in a teenage boy, which effectively he is.
Yeah.
So
well, I guess gorillas aren't as obedient as some teenage boys can or can't be.
Maybe.
Maybe.
They don't do as they're told often,
They don't, and they do have a different skin structure and more hair than people. So I often find I need to work with veterinary surgeons when I need more help with my gorilla patients.
And how's he doing now? Well, we saw the last pictures. You've got a big bandage on his. Is it his arm or is it his arm? Isn't it?
His arm.
Yeah, is he doing okay?
so far he seems to. The surgery seems to have taken away a lot of the pain. So the next day he was starting to kind of knuckle walk and do little things, which was quite scary because we didn't really want him doing too much. But he seems to be a lot more comfortable.
Conditions over there must have been really quite challenging as well.
Very different to what we're used to, yeah, yes, very different.
It's hot and very humid, and there are insects flying about as well, so you have to be careful not to be bashing yourself too much.
Do you have to take any stuff with you, or do they have the facilities?
Absolutely everything we had to take with us ×2, really, because when I was talking to Sandra and saying, will you come? She's like, yes, I'll come to Africa, and then I'll just bring this and this, and we'll sterilise more when we're over there. No, you won't. We have nothing over there. So she had to bring 2 of everything.
Not more than hand luggage,
absolutely.
then.
Yeah. Now, we said that the shooting actually happened 8 years ago. Is this still a current issue in terms of the poaching of gorillas?
It is, unfortunately. Ape Action Africa, which is the charity that works with them over there, is still having babies brought in. And I went in November to take the x-rays and back in February just now with Sandra to do the surgery. In the meantime, they've still had another baby gorilla brought in. And every time we have another baby brought in, it means a family has been killed so that they could take the baby. So it's really tragic.
That's what they do. People do it to eat, are they? Or do they? Is there anything else?
It's high value meat, unfortunately, and it's a kind of international trade as well. There is some local consumption of it, but mostly, if they kill a gorilla family, that meat will travel throughout Africa and even into Europe, where it's bought.
There has to be an awareness then of people stopping eating gorillas.
Yes, clearly, and they are.
How to do that?
They are going extinct. I think people think, well, it's just happened, or I'm not part of this crisis, but these gorillas are fast going extinct, and in 50 years' time, we know, looking at the numbers, there'll be no more in the wild. They'll only exist in zoos. So we have to stop cutting down their forest and buying their wood so we can make picnic tables in the West. And we have to start looking after the animals over there and trying to cut down this trade.
Let's hope that happens, eh?
Fascinating account. Thank you so much, both of you, for coming in.
Thank you.
Thank you.
Thank you.